I almost became one of the statistics of Black women who were 3 times more likely to die in childbirth in this country. When my placenta ruptured and I was rushed into the emergency room for a C-section, when my heart rate and my now daughter's heart rate both were crashing. The last thing I remember as I was being wheeled into the emergency room was my doctor saying, "I'm here," and a nurse putting an oxygen mask on my face and saying, "Everything's gonna be fine." And my last thought was, at that moment, I had the peace of mind of knowing that in that crisis moment, my doctor would make the decision she felt necessary in that moment. My daughter might not have that same peace of mind. Gisele Barnica didn't have that peace of mind. Amber Thurman didn't have that peace of mind. I could be here all night listing the names of women who, in the midst of an emergency or a C-section, went to a hospital in a state that bans abortion for a pregnancy they wanted. In some cases, desperately so after in vitro fertilization or fertility treatments. And they were denied care because they weren't sick enough. They were denied care until they were septic. They were denied care until they died. And that's why it's not a surprise that the states that have adopted abortion bans since the fall of Roe versus Wade also have the highest numbers of maternal mortality rates. And in the context of states where they won't provide abortions in the case of gross fetal abnormality, and those children are born, and in some cases, the minute their umbilical cord is cut, they die because they suffocate. That has physical and mental consequences for the mother and the family. That's what's happened because of these abortion bans. Now, in a lot of states, we know that the reason, so I want you to think about that in the context of cuts to Medicaid, where in many states and here at the federal level, coverage was expanded to the first year after birth. Why? Because for a lot of women, particularly Black women, you die from pregnancy-related complications within the first year, usually cardiovascular. Usually because you have an underlying health condition that has gone untreated because you don't have access to care. So by providing coverage for the first full year, we get you through and you're less likely to die. So now you got more women dying because of abortion bans. You're going to have more women die if we cut Medicaid because they don't have health care coverage after 6 months of pregnancy. And we need to look at the consequences of our actions. We need to look at the consequences. I'm a lawyer, and I know words matter. But actions matter. And the unintended consequences of laws matter. And it's life and death. It was almost death for me. And I want us to be sure that the next woman wheeled into an emergency room in the middle of a miscarriage, in the middle of bleeding out, knows, first of all, that hospital will not have to call their lawyer and say, "Is she sick enough?" That the hospital will be there because they were able to keep their maternity ward and their obstetrics unit open. And they had enough providers who said, "I am willing to be an OBGYN because I don't have to worry about being prosecuted for providing the standard of care I think necessary." And that's why this is more than just politics. This is life and death. I yield back.